House Leader for the third party.
Mr. Speaker, our Progressive Conservative Engaged document has already provided thousands of Albertans the opportunity to raise issues of concern. One of these is physician-assisted dying. This is a complex medical, ethical, legal, and moral issue, and people have strongly held opinions on this subject. There is a widespread understanding and desire that there will be a fulsome debate on this subject so that honourable members from across the province can express the concerns of their constituents. To the Associate Minister of Health, will you commit to Albertans that physician-assisted death will be debated here in the Assembly?
Honourable Minister.
Thank you, Mr. Speaker, and I'll thank the member for the question. Absolutely, we know that physician-assisted dying is a very, very sensitive issue, which is why our government has engaged with Albertans through an online survey as well as the online portal for sending in comments. At the close of the survey, we had received over 10,000 Albertans submitted their views. Additionally, myself and other members of this House are consulting with stakeholders to prepare what we heard document so that we are able to have bring forward a framework that fully represents the views of Albertans.
Mr. Speaker, no indication if we're going to debate it here in the Assembly. Given that the Supreme Court of Canada has ruled that physician-assisted suicide is legal, and given that a federal panel on this issue has made a number of recommendations that many feel fail to adequately protect vulnerable Albertans against undue pressure to request this terminal procedure, what measures is the minister considering to ensure that Albertans facing this profound stage in their earthly journey have full access to palliative care, receive full counselling support, as well as the opportunity to reconsider and renege on end-of-life decisions?
The Honourable Associate Minister.
Mr. Speaker, and I'll thank the member for the question. Protecting vulnerable Albertans is a key part of any framework that we'll be bringing forward. To that end, we know that an individual is the one who is required to make the request of their physician, and that they will be required to reiterate that request, and that at any point in the process, an individual may withdraw their consent, and the process will be halted. Thank you.
Second supplementary.
Mr. Speaker, many Albertans have also expressed concerns about doctors and medical personnel who previously focused solely on healing and relieving suffering to now being called on to end the lives of their patients. Given the profound burden that this places on these professionals, none of whom have had training dealing with the mental strain of performing euthanasia, to the minister, working with the College of Physicians and Surgeons and the Alberta Medical Association, what measures are being developed to support medical personnel suddenly faced with this challenging ethical situation?
Honourable Minister.
I'll thank the member for the question. To date, we've had 80 doctors who have stepped forward and indicated their willingness to participate in physician-assisted dying. Working with the College of Physicians in Alberta, I had a meeting with them just earlier today. We've been talking about different training modules that will be available, as well as supports that will be available for any of the medical professionals that aid someone in the decision to end their life as part of their end-of-life care. And as we continue to move forward with this issue in advance of the June 6th Supreme Court deadline, we will continue to work with our partners across healthcare.